First of all, we will see much more CAR T cells. We will see CAR T cells that have humanized scFv domains so that they might be less immunogenic to improve the persistence of the CAR T cells. There are different strategies to improve the production of CAR T cells, to make the production quicker, because at the moment we are often waiting 6 to 8 weeks until we finally get the product for our patients. So to speed up production is an important issue. And also allogeneic CAR T cells could be an option because they are really off the shelf. But at the same time, we see an enormous increase in bispecific antibodies. For both CARs and BiTEs, we see that not only BCMA is targeted, but there are new targets, GPRC5D, FCHR5, and SLAMF7. So a lot of new targets will come. So it's an enormous program. And we also see NK cell CARs, NK cell engaging antibodies. So I think we can really foresee a lot of new developments in the immunotherapy of multiple myeloma, and hopefully even better success than we are achieving at the moment.